Hello and welcome to Politico Live. I'm Ashley Furlong, a healthcare reporter at Politico. This event is the last chapter of the Evolution of Healthcare series, and for this panel, we'll be looking at the health consequences of climate change and where Europe is headed. Every study, every new piece of data that lands only seems to add to the ever-growing mass of evidence we have on the effect of the degradation of the environment on human health. The World Health Organization says climate change is the biggest health threat facing humanity. It threatens much more than just individual human health and puts progress in development and poverty eradication at risk. How Europe is responding to climate change and environmental damage is going to help shape the outcomes for the whole globe. We have an excellent panel that will help make sense of this important issue. But before we start, I would like to thank our partner, Janssen, the pharmaceutical companies of the Johnson & Johnson, for making this event possible. Also, a big thank you to our viewers online. Just because you aren't in the room with me doesn't mean you can't ask questions. To do so, you can go to slido.com and use the hashtag #EvolveHealthcare. I'll be asking those questions throughout the panel. I see there's already a couple on Slido. During the event, please also tweet using the hashtag #EvolveHealthcare. Before we kick off, we have a poll presented by our partner Janssen, and I'll be coming back to the results at the end of the panel. The question of the poll, which you can access on Slido, I see some of you have already answered it, is what should the EU's priority actions be to effectively face the health consequences of climate change? 1, future climate investments that positively impact health. 2, overcome policy fragmentation and silos in EU policymaking. 3, use existing instruments such as procurement practices as levers for change. And 4, foster more health environment stakeholder coalitions. With that, I'd like to welcome Mark Hicken, Vice President of Strategy for Europe, Middle East, Africa at Janssen, the pharmaceutical companies of Johnson & Johnson.
Good afternoon. I'm pleased to open this Politico live panel event on facing the health consequences of climate change, and I'm looking forward to the discussion that will follow. Healthy people need a healthy planet, and the science continues to show that our planet is not healthy. Higher temperatures, more frequent extreme weather events, and many other impacts are disrupting our communities and livelihoods and affecting our health. In fact, the World Health Organization calls climate change the biggest health threat facing humanity. So biopharmaceutical companies, public health professionals, and political leaders need to do some high-level thinking. How can we anticipate the environmental effects of climate change, and what can we do to minimize healthcare risks? Climate change undermines many of the social determinants of good health. Things like jobs and livelihoods, equitable access to healthcare and social support structures. And these impacts disproportionately affect the most vulnerable and disadvantaged. Climate change also impacts health by disrupting food systems, contributing to mental health issues, and increasing disease, including those that can be transmitted from animals to humans. And just how much will global warming enable further spread of disease? Well, the early signs are worrying. The 21st century has witnessed a wave of severe outbreaks, not least of which is COVID-19. Lives and livelihoods around the globe have been devastated, and changing climates mean loss of biodiversity and intensification of agriculture all play a role in increasing the risk of pathogen spillover. Mosquitoes will roam beyond their current habitats, spreading diseases like malaria, Zika, dengue fever, and West Nile virus. Climate change will also affect non-communicable diseases like asthma and cancer. In fact, escalating environmental health risk factors are predicted to cause increased rates of both lung and skin cancer. And there is also a clear direct risk to our healthcare infrastructure. If climate change increases the frequency of pandemics and severe weather events, health services will suffer. And this will most acutely affect low and middle income countries, which already have fragile and fragmented healthcare systems. At Janssen, we're part of Johnson & Johnson, the world's largest diversified healthcare company. We aim to make a difference on a global scale at the intersection of human and environmental health. And we recognize our responsibility to have a positive impact on our environment. We began setting climate goals 20 years ago, and our new climate commitments are our boldest and most ambitious yet. By 2030, we aim to achieve carbon neutrality in our operations. We finalized 3 wind and solar deals that will bring us to 100% renewable electricity across all European operations. That's more than 40 sites across 11 countries. In Belgium, we have our own wind turbine in Giel, and with the support of the Flemish government, we started a geothermal project on our site in Beerse. We are also committed to building a resilient and sustainable supply chain. We're working with our suppliers to reduce our upstream carbon footprint by 20% by 2030. And we're reducing the environmental footprint of our own operations, our products and packaging, and our extended supply chain. We're confident we can achieve these goals. But this will obviously require a huge joint effort, and we firmly believe in the power of partnerships. Following COP26, and new calls for climate action from the WHO, there's a greater sense of urgency for governments to act, and to act now. In the Paris Agreement, nearly all countries and industries have committed to reducing their emissions, to working jointly to address climate change, and to strengthening their commitments over time. For Europe, achieving net zero will be very challenging. There are some unique geographical and societal hurdles to overcome, but we stand ready to partner and collaborate with governments, and we must be ambitious. We need to focus on green investments and make climate investment decisions that positively impact health. We need to overcome policy fragmentation, lack of financing, and silos in EU policymaking, and use existing instruments such as procurement practices as levers for change. We need a collaborative approach with all healthcare stakeholders to improve environmental performance. These are just some of the actions we urgently need to take at both a European and a local level if we are to effectively tackle the health consequences of climate change. I look forward to what I'm sure will be a very interesting debate on these and other necessary steps. Thank you for listening.
It seems Mark's already answered some of the questions I was planning on asking our panelists. I'm going to introduce you to those excellent panelists now. We have Zorana Jovanovic-Anderson, Professor of Environmental Epidemiology at the University of Copenhagen and Chair of the European Respiratory Society's Environmental and Health Committee. We have David Nabarro, Chair of Global Health and Co-Director of the Institute of Global Health Innovation at Imperial College London. We have Agostino Di Cialo, Continental Vice President for Europe for the International Society of Doctors for the Environment. And we have Philippe Roux, Head of Unit Health Information and Integration in All Policies at the Director General for Health and Food Safety at the European Commission. I wanted to start by setting the scene about the links between climate change and poor health. You know, it's a really massive topic, but I think it'll be useful for everyone watching if we sort of set out what we know and why the situation is getting worse. Zorana, you work on this research every day. You know, how has what we know changed over the past few years? You know, have we reached a point, for example, with air pollution research where the evidence of multiple health outcomes is sort of irrefutable?
Yes, thank you, and thank you for inviting me to this very exciting panel and very timely topic. As you mentioned, we work a lot on air pollution in my group, and we are working a lot to bring air pollution as an integral part of climate change agenda. I think we heard already in excellent introductory speeches on impact of climate change on health through weather changes, through natural disasters, through temperature increases, flooding, hurricane storms, changes in weather. But cost of air pollution is actually the most prominent cost indirectly through climate change, as the sources of climate change and greenhouse gas emissions are the same, and the main causes of air pollution exposure that's detrimental to health. So last few years, we have a massive new evidence on impact of air pollution on our health. WHO has just published a few months ago a new air quality guideline that has shown that we actually have air pollution impacts pretty much at very low levels, that everybody is exposed, we have no lower threshold, and also summarize that health effects of air pollution with what we know now, with research in last 10, 20 years, are much larger than we knew previously. Over 7 million people die prematurely due to air pollution globally, and we have effects on cardiovascular health, respiratory cancer, premature mortality already in neonatal phases. We know now also that we have impact of diabetes on cognitive health, cognitive development in children, at risk of dementia. So full impact of air pollution on health, we haven't mapped yet. It's increasing, and this adds really a strong argument to mitigation of climate change as a side effect, that we would have huge improvements in health.
Thanks, Sorana. David, would you like to sort of expand on that and look at climate change more broadly? I know your role, obviously, in global health, and maybe you could also talk about how this is affecting health systems around the world.
Thanks very much indeed. Like other friends, I'm just going to start by acknowledging this extraordinary opportunity to participate today. And for me, as somebody who's been involved in public health for several decades, I want to totally agree with the opening remarks about where WHO has put climate change in regard to threats. Quite simply, the change in the world's climate is far and away the greatest threat to people's health and well-being. And it's because this is an exponential phenomenon. We know that the Earth is heating, and it's heating more and more rapidly each year. So we are locked into an inevitability of rising temperatures. And the question for all of humanity is simply, how much can we slow it down? Can we keep it so that the average rise in temperature is close to 1.5 degrees centigrade? Or given the difficulty that nations are having with agreeing reductions in overall greenhouse gas emissions, is it inevitable that the average temperature will stabilize when we've eventually managed to get our emissions down at, say, 2 or even 2.5, or as some people say, 2.7 degrees centigrade? There's a huge difference between a world that lands with an average increase of 1.5 degrees compared with pre-industrial levels, and a world which has an average increase of 2.7 or so degrees. And the difference will be measured in terms of the numbers of millions of people who suffer. And the suffering will be across quite a broad spectrum, and we should be matter of fact about it, as well as at the same time expressing our anxieties as well. The matter of fact side is, quite simply, there's going to be direct effects on people as a result of overheating. And we know that the incidence of a whole series of illnesses, from heat stress through to suicide, just goes shooting up as temperatures rise up into the 50s. And we're seeing how in the Middle East right now, temperatures in the mid-50s are really common, and that's having direct impacts. Then I was involved in the Food System Summit in September this year, actually, and I heard from around a third of countries that we've got a big increase in food and water insecurity. And lastly, I just want to stress that as well as the air pollution that we've already heard about and the communicable diseases that we heard about as well, we're going to have widespread social and economic instability as a result of climate change. And that's going to lead, of course, to breakdown in governance and all the other consequences. This is going to be very serious. Back to you.
Thanks, David. We're going to talk about some of those, efforts to bring down emissions a bit later. But Agostino, I wanted to go to you. You're a researcher and a clinician. You're straddling sort of this barrier between, treating patients and then researching the causes of their ill health. What do you think about the interaction between the COVID-19 pandemic, climate change and poor health? Are these sort of three different things coming together here? And what is the possible effect of that?
Hi, Ashley. Good afternoon, and thank you for inviting me. Yes, we are now living in a kind of a perfect storm in which the pandemic is widely interacting with the causes and effects of climate change, with the growing incidence of non-communicable diseases, with the progressive aging of the European population, with the increasing delivery of chemicals into the environment, and in a wide background of social inequalities, economic discriminations, supremacy of unsustainable forms of industrial expansion, and increasing environmental harms. we are now living the negative effect of a syndemic rather than a pandemic, a simply pandemic, which is amplifying all pre-existing criticalities worldwide, is increasing individual vulnerabilities, and is progressively decreasing the possibility of resilience, with a further worsening of health outcomes on a global scale. In this scenario, we should also recognize the onset and the spread of the SARS-CoV-2 infection as one of the possible negative effects of climate change. If you think that climate change led to a marked reduction in biodiversity, and this in turn we saw in the past predisposes to the transfer by species crossing of several viruses from one species to woman. At the world level, a 1 degree centigrade temperature rise above pre-industrial levels has been linked with new and emerging infectious diseases. And we know that a further inaction to reduce the effects of climate change and the environmental burden of disease, in particular non-communicable disease and individual vulnerability, can strongly increase the burden of COVID-19 and the effects of climate change, can promote the onset of new pandemics. However, we still continue to consider health and climate separately. And the present syndemic, as the effects of climate change, cannot be solved without a global approach able to reduce vulnerability and to increase the possibility of resilience, and putting health at the center.
Thanks, Agostino. You just said, we still consider health and climate change quite separate. I wanted to go to Philippe here, because his role is almost, meant to bring these aspects together in the Commission. And I wanted to ask him, how do we begin to break down these silos that have, sort of been established from many years? And, what can the EU do to actually help bring down these silos?
Thank you. First of all, thank you very much for inviting us to this session, very important one. I mean, the scene setting was dreadful, and I will not insist on that part. And I really would want to come with a sort of more positive tone, because when we listen to the colleagues, and they are right, the situation is very impressive, and we are in a very difficult situation, and we have only one Earth. So that's clearly very important to ensure that we are able to answer to it. Our host mentioned silos, and I think really you rightly say what we are doing in the Commission is really, we had a revolution, I think, already a couple of years ago, which is even for the public, it seemed that the idea is still that we are working in silos. And I really think that it is not anymore the case since now really long time. Of course, it's very difficult to coordinate different policies, but I think the Commission took very serious the issue and did indeed commit to very strong policies and to coordinate activities and coordinate the different policies. And of course, the Green Deal for me is really an excellent example of that, where we are working on all the different policies that we are responsible for in the Commission, and putting all the efforts to ensure that we contribute to very ambitious goals. I think don't forget that we have agreed to help reaching climate neutrality by 2050, which is not nothing, and already intermediate targets by 2030. So it is not just a political statement, it's really a convergence of actions towards climate and health goals. And that's, I think, it's a very good news in a way, in a context which I agree is rather impressive. Over to you.
I wanted to come to a question that actually, sort of links with what you're saying from our Slido poll. you saying what the Commission can do, and I suppose that's also what governments can do in creating these policies, to put us on a better path. But the person is asking, can industry, people like doctors and healthcare professionals, really mitigate the health effects of climate change when they have no control over climate policy? So, are those little incremental things that you do as an individual or as a doctor actually going to have any effect? I'm not sure if any of the panelists want to broach that. David, would you like to give that one a go?
Well, I only stuck my hand up, honestly, Ashley, because actually last year, in an event called the World Innovation Summit for Health, we pulled together a group of 10 people to produce a report called Health in the Climate Crisis. And we invited the specialists who came from a number of organizations that represent medical, nursing, and other professionals around the world. And the question was as follows: what is the contribution that health professionals ought to be making to the climate crisis? And the answer was overwhelming. We were told, whenever health professionals are given an opportunity both to act themselves on the climate crisis and to convene action by others on the climate crisis, it would appear that they have an extraordinary impact because of their role as health professionals. They're appreciated for their understanding of epidemiology. They are also appreciated for being people who primarily are not biased and who focus on the well-being of everybody. And so the conclusion was that there are actions that health professionals can do for themselves. There are actions that health professionals can do as leaders for others. And we took the liberty of producing a 10-point index card that we suggest that every health professional carries around in their pocket. 5 actions for them themselves, 5 actions for them as leaders. And now what we want to do is to spend more time with others, empowering the world's health professionals to be not just speaking out, but also connecting up for climate action.
Agostino, do you think that health professionals have the sort of capacity at the moment to be able to do this, given the pressures that they're under with the pandemic, and also given that this might have not been, part of their curriculum as, when they were at university? This might not have been something that they were ever taught. So I think those, do they have the time to do that, and do they have the expertise, is my question.
Yeah, there is a great debate. And first of all, I would like to say that, as always happens in terms of primary prevention measures, health professionals can also suggest the way, but are policymakers that have to do change. What we are wondering, what we should wonder is what are the main obstacles to change? What are the causes of inaction? And my feeling is that looking at the pandemic on one side and at climate change on the other side, what emerged clearly is an asymmetrical use of the scientific evidence we put on the table. This is fully correctly and adequately considered to face the pandemic, and vaccines are the demonstration as the best primary prevention tool now available, although still not in all countries. But on the other hand, we have strong scientific evidence indicating the solution for climate change. But this evidence is usually scarcely considered to build a rapid and efficient exit strategy from fossil fuel and from unsustainability. The feeling is that the main obstacles are the fear about a decrease in the gross domestic product, and as a consequence, the lack of primary prevention measures. That is a critical point. Both these elements derive from an inadequate post-analysis. It is strange to hear a doctor speaking about cost analysis, but it is another critical point, because an inadequate cost analysis does not consider possible savings in terms of primary and secondary costs, health costs, and externalities reached through measures aimed to reduce the delivery of environmental pollutants and the contamination of food and water with toxic chemical of anthropogenic origin. We urgently need to consider health as a priority on budget agenda.
Thanks, Agostino. I saw Zorana wanted to come in here.
Yes, just to make a comment on a healthcare professional role, of course, they carry a great role. I think as soon as and maybe we were slow to accept climate change as well as air pollution environment as a public health crisis, as climate change factors and air pollution environment as a health risk factors, then of course it's the healthcare professional health systems that have to, in the first line of getting this new knowledge to the patients, working with patients to make them aware of the impact of environment and climate change on their health, first in aligning solutions, in assessing these exposures and helping their patients how to, both in primary prevention, but also in secondary, and many patients that suffer from heat exposures, from air pollution. So of course, in ERS, in European Respiratory Society, we work now for decades directly with respiratory clinicians in informing them the latest both in air pollution and climate change. So they have a huge, very important role, and we have to support them also with continuous education in delivering solutions to patients while the big policies and big changes happen. But I would say healthcare has a central role in alleviating impacts on the human health.
And one relatively new initiative is the European Climate and Health Observatory, and that's kind of, it's set up by the Commission and the European Environment Agency and several other organizations, but it's aiming to sort of bring what we know together into one sort of like a one-stop shop, in I would call it that. And, it's been a couple of months since it's been set up, but Philippe, I wanted to know what progress is being made with it. Are people using it, and where, I know that there's a plan for where it's going to go. Can you tell us, where the project's going to be going in the next couple of years, if you know that yet?
Well, the first thing I want to say is indeed that it is a proof of the fact that we are working across silos, as it was said before, because it's a cooperation between DG Climate, DG Santé, and the European Environment Agency, and several important other players, among which WHO, of course, and a lot of others. And really, that's for me that it is the first information I wanted to say again. The second regarding where we are, I think it was indeed created with this idea that information already exists. It exists in different places. It was mentioned before that we have different type of health impact on health, different type of diseases, and what was very important for us was to find a way to bring all this knowledge in one place where it is easy for whoever has to develop a policy or develop an initiative to find the right information and to be sure that it is solid and valid information. And that it is the ambition of it all. So we ambition to cover the entire scope that was described so far of the different risks and disease, from heat waves to waterborne disease. I mean, really, we want to look at all these aspects and to bring that information available to everybody. So it's a collective effort from different parts of the Commission and from different institutions. And really, the idea is to make visible and easy access in an easy, understandable language, because also one of the risks is that experts are talking to experts. And one of the virtue of the work we are doing with this observatory is to try to bring the information at a level that is understandable by every citizen, and that's very important. And I wanted just to go back, if you allow me, on these points on the importance of the health professionals. I can't resist mentioning it, because for us, one of the key elements is equity, and of course, reduction of inequalities. And really here, one thing which we observed is that health professional access to some vulnerable groups that we don't access at our level of action. and therefore they will have an important role to play. They should not be alone, of course, and they should be helped, and we should work together. We, for instance, I'm thinking of one of the activities we have with the health policy platform, where we create space for different professionals, actors to discuss and to work together, including sharing training material, for instance, sharing important reports and material. These are the type of, let's say, activities that, from the Commission perspective, we can add to what the professional, the health professional, will have to do, because they are they are forefront. They are the one that are confronted to the vulnerable group. So they have an important role to play. Over to you.
Thanks, Philip. Speaking of inequalities, there's also this large divide between what rich and low and middle income countries can do to respond to climate change. Sometimes things that climate activists sort of really oppose, like carbon markets, are vital for poorer countries. David, is Europe doing enough to support the rest of the world in moving towards a more sustainable future?
Thank you very much indeed. Of course, there's always going to be, I think, questions about how Europe is working with other countries, given the relative wealth per capita of European citizenry, and the wish by some European countries quite overtly to drop their international development spending. Well, whether it is being applied to the pandemic or to the destruction of nature or to climate action, the one thing that I've learned, and I wonder whether colleagues agree with this, is that there is no way individual nations can really expect to deal properly with the global existential threats that are endangering and threatening hundreds of millions and even billions of people. And so for me, the only way to deal with global issues is with a true joined up global response. Now, in the annual COP meetings, it's been interesting to see how fragmented the discussion is. You get a lot of conversation on mitigation, and that means working on the relatively small number of countries who are finding it super hard to reduce their very high levels of greenhouse gas emissions. Or then there's another discussion on adaptation and resilience, which is looking at, of course, the very large numbers of people whose lives are being turned upside down as a result of climate change. But the two schools of thought have only recently been joined up together. And for me, the one thing that European nations could, and I would like to suggest should do, is to shift from this fragmented approach to dealing with climate change, breaking it down into sectors, dividing it into mitigation and adaptation, and just recognize climate change is an issue that's affecting, as we heard just now, systems in multiple domains, and the only way to deal with it is with a joined up global response. And the sooner that we can move towards Europe and other regions working with others on an overall global approach to these issues rather than piecemeal, I think the better humanity will be. I hope I addressed, Ashley, the question as you wanted me to.
Yes, you did. And I think you put a question out to the other panelists if they agreed with you. I'm sure that they do agree with you, but I wanted to know if anyone wanted to add to that. Zorana, you were following COP26 quite closely. Is that sort of the same takeaways that you got?
Yes, so this was important. COP for Health. This is the first time the health and WHO had a health as a part of COP. Probably way too late, but nonetheless very significant. And I think the problem of the COP that health has not been dominantly present in negotiations and not even at COP previously. And so mixed feelings about what came out of COP, but I fully agree with David. Climate change, environmental issues do not know borders. Something like air pollution and transboundary transport of particles and air pollution that we see within Europe. Even within Europe, not just outside Europe, we have still huge differences between East and West in pollution, in emission of fossil fuels, in residential heating issues, and so on. So for Europe also, European-wide solutions and global solutions are necessary. And if COP didn't accomplish more, putting everybody around the same table is extremely important. And I fully agree there with David. Also acknowledging the large inequalities in environment and climate change impact is extremely important, and providing necessary economic support to poorer countries, to the most sensitive groups of societies, to be able to adopt this mitigation and adaptation strategy is extremely important, because even Europe in the East, we have such energy poverty and no alternatives for some of the groups of citizens that we have to support the measures and new policies with support for these most vulnerable groups and most poor groups in Europe and globally, of course.
I'm going to come straight back to you on, earlier you mentioned the World Health Organization's new air quality guidelines. And, I wanted to know two sort of things, do they go far enough, the guidelines? And then, they aren't obviously legally binding. So, how valuable are they, just to have these? We have many guidelines to tell countries what to do and how they should do things, but have we seen during the pandemic, they don't always listen.
Very good point. Guidelines are evidence-based limits for how low air pollution should be set if it's in the interest of protecting our health. So yes, they do go far enough, fully supported by solid science that we have. They tell us pretty much with the levels now that we came down all the way down to 5 micrograms per cubic meter for PM 2.5 and 10 for NO2. This really means for global populations that we are all exposed to dangerous levels of air pollution. Even here in Northern Europe, where I sit and do research in Copenhagen, some of the cleanest parts of the world, everybody's exposed to dangerous levels. So we have a public health threat that everybody's exposed to. That was one very important signal of this WHO air quality guidelines, what lowering of values is telling us. So these are not legally binding, no, but we have now European Commission and European Green Deal that is very ambitious and committed to listening to WHO and their language. And now we are very carefully watching what's coming up with the upcoming air quality directive revision in next year, and public consultations are open. And there is a language that we are expecting. We're hoping for full alignment of upcoming EU legislation with WHO guidelines. We are very much advocating for that. We know now that EU limit values that are 5 times the for PM 2.5 WHO guideline are not protecting health. We have compliance with current EU limit values, but we know that we have still very adverse health effects below. So we have this huge gap in current legislation and what limit values should be. So we are at a very exciting time, and I think that we hope that the EU will lead and set example for the world with this very ambitious EU Green Deal and specifically air quality legislation.
Thanks, Sorana. We have a couple questions that I think would fit quite nicely from the audience. One person's asking, I'm not sure if anyone knows the answer to this, they say, to the panel, what would a healthcare system need to look like in a 2.5 degree warmer world? So how, I suppose this is the question, what do we need to do to health systems to prepare them for this? Or, how would they actually function? Would they be able to function? Does anyone have an answer to that at all? Does anyone want to give it a go? How would we restructure these health systems, David?
Thank you very much indeed, Ashley. I just had one comment I wanted to say about this, following the work that I was involved in last year that I mentioned before. Colleagues from the Philippines were very clear to me that a resilient health system has to be made so that it has built-in capacity to cope with all the shocks and stresses that can be thrown at it, and particularly adverse weather events, because it's not as though a 2.5 degree world will just be characterized by hotter temperatures. No, we may understand that it's actually going to be characterized by greater frequency of really unpleasant weather experiences, storm surges and floods, periods of drought, periods of extreme wind, may even be typhoons, and so on and so forth. So it's that built-in capacity of resilience to cope with everything nasty that the weather can throw at you, and then to have systems to keep working that might include not having a center that people come to, because that might get cut off by weather or other such issues, but building up capacity in local communities for neighborhood healthcare of the kind that we have always believed to be ideal. But this might become, I believe, the necessity, especially in communities that are at high risk for adverse weather events.
Thanks, David. We're going to shift a bit to sort of looking at the pharmaceutical industry, as we have two questions that are quite upvoted that people want to know. I thought maybe Agostino or Philippe, or both of you could answer this. The question is really, what role does the pharmaceutical industry play in addressing climate change? And the person was also asking, other than sort of, very sort of individual things for the pharmaceutical company, what kind of role do they play here? Agostino, do you have any thoughts on where the pharmaceutical industry fits here?
Yeah, another critical point to face climate change is to change lifestyle, food system, and diet. For example, we have to reduce meat consumption and to adopt more sustainable agricultural practice. 1 in 5 deaths, about 11 million deaths every year are associated with unhealthy diets, and we need to encourage the transition to healthier and more sustainable lifestyles and consumption model, both at individual and at a global level. But we also need better agricultural practice.
Affordability?
Sorry?
Carry on. I think there was a strange sound. I was ahead.
I'm sorry. We also need better agricultural practice in the change of food production. Current food systems are based on industrial production methods and are driving global trends toward malnutrition, food insecurity, unhealthy diets, and related disorders. So it is important the individual responsibility of change, but it is also important investments that necessarily will involve cooperative, industrial, and political choices. At all possible levels, our common goal should be to invest in primary prevention measures in order to decrease our vulnerability and to increase resilience. And about COP26, health professionals had great expectation in COP26, and COP26 generated an inadequate participation of health professionals, underlying the huge involvement of health professionals in the field of health affecting climate change. However, it seems an organization representing more than 46 million health professionals signed an open letter presented at COP26 with a call by urgently step up climate change. However, it seems that national climate financing commitments still fell far short of what is needed at both a global and individual level, also in terms of educational programs. The main commitment seems how health systems can adapt and respond to climate change, waiting for a definitive solution, but this is not enough. Building a resilient system is a critical challenge, but is not the only priority. The priority should be to rapidly build primary prevention measures acting at all levels, also individual, but at the global levels. These measures will be able to avoid the devastating environmental and health effects of climate change and to face inequality, able to increase vulnerability.
Thanks, Agostino. Philippe, do you have anything to add about pharmaceutical companies and their role and, what they can do to improve, sort of prevent climate change, or any of the other panelists? Anyone want to add anything about what role pharmaceutical? Philippe,
Well,
yes, I see you.
Clearly, what is very important is innovation. And really here, of course, pharmaceutical companies have an important role to play. Another key role, I think, as it was mentioned, we are talking of creating our health systems that are resilient, and resilience. The COVID crisis proved that it's important for our health system to be resilient to cope with crisis, and climate change crisis also will require a huge resilience. And here, of course, another element is certainly affordability of pharmaceutical products. So that's also a key element. So these are the two elements that comes to my mind about this issue. The previous panelist mentioned indeed an aspect that is perhaps not obvious at glance, which is indeed the importance of our capacity to have, with climate change, to have sustainability of the food chain. And here, what I would want perhaps to draw your attention, it would be too long to elaborate on it now, but if you're not familiar to it, it's very important that you have a look also to the Farm to Fork strategy of the Commission, which is really at the heart of the Green Deal that I mentioned before. So it's really one of the key points here. And this one is also, Farm to Fork is really, among other things, a real opportunity to help citizens to be better informed and to improve their lifestyles and their health and contribute also to the environment. Over to you.
Thanks, Philippe. I wanted to sort of take a bit of a bigger picture. Earlier we were talking about COP26 and about, having, bringing sort of different countries together. But at COP26, we also saw many countries, didn't attend in person. They were sort of virtual. And, while we might have seen a sort of a united European presence, that wasn't the case for, across the globe. We didn't have that global response. And I wonder, maybe David, you could answer, how Europe can bring those harder to reach countries on board. How do we sort of move them along the line that sort of Europe has set with climate change?
Yes, thank you, Ashley. For me, the frustration in climate discussions over many years has been this separation of the focus on mitigation, i.e. reducing greenhouse gas emissions, and adaptation, i.e. societies finding ways to function despite the consequences of climate change. The separation has always meant that there are two conversations going on. One is the conversation among the high emitters, perhaps 25 or so, trying to find ways to persuade them to cut down their emissions, recognizing that there are tricky political economy factors, and also recognizing that there are a whole stack of reasons, including practices by different stakeholders, that make it really quite hard to get more rapid decarbonisation. Some progress was made really in Glasgow, but more to be made. And then you've got the whole adaptation discussion, which affects hundreds of millions of people, and which is what makes people in poorer countries like Pacific Island nations, absolutely incandescent with a deep anger that somehow they are being sacrificed to enable the small number of countries with high emissions per capita to go on doing so. It'll change. And one of the reasons why having health professionals involved is that, as I see it, health professionals are much better than most people at working through the total consequences for a population of continuing with a particular set of policies. Health professionals will identify the equity consequences of this. Health professionals will identify the massive mental health consequences of continued emissions at the rate we're doing it and moving towards a 2.7 degree world. Health professionals are going to have to sound the alarm. It's frustrating that they haven't perhaps done so as much as they could have done already, but it's not too late. And I so agree that there were 70 events at COP26 around health and climate, and that was compared with the number of events that could be counted on two hands in previous COPs, in particular in Madrid. And so, look, everybody, let's make sure health is never going to be absent from the center of climate discussions from now on. And we're going to link together health, climate, nature, and resilience of humanity. And finally, we're going to make certain that every health professional is enabled to realize that they are the leaders for climate action, along with others, but they are vital leaders. And please can they do so, because the rest of the world needs it. Thank you.
Thanks, David. I want to sort of, as we're getting to the end, bring it back to the individual. We have a question which, I'm also interested in, and maybe Agostino and Zorana could both answer this one. It says, how much and what can individuals do to lessen the impact of environmental threats on their personal health? Is it dependent on resources, like moving out of cities? So I think listeners might want to know personally, what can they do to better protect their own health? Zorana, would you like to go first?
Sure, that's a very good question. So again, awareness of how air pollution affects health, what diseases, and awareness of the situation of the information on air pollution levels in the cities where we live, on the streets where we live. We have that openness very much here in Denmark and in Western Europe. We cannot do too much. Of course, moving out of city, as I said, everybody's exposed to air pollution. Even moving out of city will put you in a traffic problem, commute to the city where you work. So we cannot completely avoid air pollution. We should do as much as we can to try to avoid it, to choose, as we said, recently we had research on exercising in the cities and found that it's still healthy to take a run in the city, although you may be inhaling more air pollution than not taking a run, because physical exercise is so good for the health, in mental and physical. So try to avoid busier streets if you can. Try not to pollute if you can. Try to take your bike and leave your car if you can. That will also improve your health mentally and physically by exercise you're gaining, or take a walk. If you can do so, do in a park. If not, still be aware of the air pollution, both on your health and how do you contribute to emissions and the climate change and air pollution problems. So that's a brief answer. Of course, if you're patient and you experience, a lot of asthma patients, respiratory patients experience themselves, they have exacerbation of disease when in traffic, when they fire a fireplace or are close to a source, and they should get some support from their physicians, and they're mostly more aware because they experience on their own health. And they take precautions, of course, to stay away or change some of their habits.
Thanks so much. That was very useful. Hope we're all taking notes. Agostino, do you have anything that you want to add?
Yeah, it is very important to, as I already told, to change individual lifestyle also, because the main topic for individuals is to decrease their vulnerability. So eat less meat, consume more vegetables, take a distance from a model of linear economics, so recycle, don't produce much waste, and use organic food to reduce the consume of pesticides and so on. But all these considerations must take into account the concept that not all individuals are equal. So we can do very poor actions if we belong to vulnerable groups. Since some groups of the general population are particularly vulnerable to the effects of climate change due to physiological or pathophysiological conditions. So in this case, the responsibility cannot be of the individual. Children younger than 1 year and adults older than 65 years, subjects suffering from chronic diseases or disability are critically vulnerable to climate change, but increased levels of vulnerability also involves economic and social disadvantaged people, ethnic minorities, migrants, or displaced persons. In this case, putting underlying the individual responsibility is not the best thing. Increased social deprivation represents a key factor in making people vulnerable and predisposed to more adverse outcomes related to climate change impact. This evidence has a critical role in terms of primary prevention.
Thanks, Agostino. I think it's clear that we are already facing devastating effects from air pollution and climate change more broadly on our health, and that there's still a lot of work to be done, and that healthcare professionals are really important here. And if we don't make these investments, the most vulnerable in our society will be further disadvantaged. I want to just go to the Slido poll, which is quite an overwhelming result. It's going to pop up for everyone watching now. So the question was, what should the EU's priorities actions be to effectively face the health consequences of climate change? And in the results, we can see, so future climate investments that positively impact health is definitely the most important one. And I think that sort of reflects what we spoke about today. Thank you to the audience at home, and a big thank you to our partner Janssen for making the event possible. Please do send your feedback on the session to live@politico.eu. And next year, hopefully, we have much more sessions in person, and we can see you all in person. So look out for Politico Live's events next year in 2022. Thank you and goodbye.